This is the MelaFind machine, which is brand new technology which enables us to see through the skin, be able to see how a mole is developing in 10 different sections, 2.5 millimeters under the surface of the skin, when we see someone who has a mole that we might be suspicious of. Every day we see patients who come in for skin checks, and we're looking at hundreds and hundreds of moles every day, and every once in a while we see one that just doesn't fit the normal pattern, that it's a little bit irregular, may have a little variation in the color, a little smudgy edge, and then we're left with a dilemma. Do we follow the patient? Do we biopsy the patient right then? And that comes up on a daily basis. With this new technology, we have another way of making a decision. Do we do a biopsy or do we follow the mole? This MelaFind technology, we initially will take a picture of the mole that gets scanned into the machine and into the patient electronic medical record. Then we take the MelaFind handpiece, put it up against the mole, and then this will shine various wavelengths of light that will then give on the screen a picture of the mole in 10 different sections, 10 different levels, and then because of the large database of melanomas that has been studied through this device, it gives a predictive score as to the level of organization or disorganization of the mole, which would be related to the possibility of this being a very early melanoma. So if you have a low level of disorganization, a very low score, you wouldn't need to do a biopsy. If you have a high level of disorganization and a high score, then you would want to do a biopsy. And interestingly, this device is far superior in terms of being sensitive to very early melanomas than the best of dermatologists. Because MelaFind has been shown to be superior in the very early diagnosis of melanoma, when we can cure people before they have potentially life-threatening disease, we have to have this available for our patients to give them the highest quality care.